So we've just got some testimonials because me and Vicky have kind of told you how great we think the course is, but we thought it'd be good for you to hear from some of our students. Olivia will know these students as well, so it'll be nice for Olivia to see these. So Julia is one of my students. She's on the right in the picture. She started in January of this year, 2021, and during January she was an admin member of staff. The extent of her medical training and clinical training was care navigation on the phones to direct patients to the right clinical member of staff. And already she's running her own clinics. So within 5 months, she started running clinics, taking physiological measurements, participating in the COVID clinics and vaccinating everyone. So their development has been really significant and has benefited both Julia and her confidence and her career progression, but also her workplace massively, as they've been able to relieve some of the extra pressures put on practice nurses into Julia as a senior support worker. So it's worked really well for them. The next one is Laura. So Laura is close to finishing her apprenticeship now. She worked as a HCA within an acute medical setting in the hospital for 7 years. Due to personal circumstances, she had to get a different job that suited working hours better for children. So she worked in an office for a while and then returned to the healthcare industry. I think once you've worked in it, I think you can't leave it for too long. So she returned to a GP setting, and even though she had an extensive amount with 7 years experience, the type of work required from a HCA in a acute medical setting on a ward is completely different to the skill set and requirements of someone in a GP surgery. So Laura undertook the apprenticeship to help develop her confidence, her skill set, and her knowledge around more clinical skills, because she had the interpersonal ability and able to deliver personal care to an excellent standard, but her clinical skills were not as developed as required for her role. So now she's running her own clinics, and as you can see there, she's kind of listed kind of what she does on a daily basis, so taking bloods, ECGs, undertaking health reviews for diabetic patients and patients with hypertension, and she's also helped assist in minor ops and women's clinics. So compared to what she'd previously been encountering, she's significantly improved, and her confidence has grown significantly, and now she's confident enough to apply for the nurse degree apprenticeship, which is great to see. And then we've got Nafisa, who works with Julia, and I think Olivia will know this student too. And Nafisa, again, same as Julia, significantly developed her skill set, her confidence. She, again, is running her own clinics. They've just done some more immunisation training. And as she just says, really, it's been one of the best decisions that she's ever made. I think as she'd expressed as a more mature learner, she was a bit worried that her learning capability might be hindered compared to others, but in the space of 5 months, she's gone from GP receptionist to a fully functioning senior support worker within the practice, running her own clinics. So I think her kind of sentiment there of it's been one of the best decisions she's ever made says it all, really, for me.